welcome to the deep dive. You've shared some really interesting material with us, and today we're going to unpack a common concern for quite a few pet owners, lymphocytic-plasmacytic gastroenteritis, or LPG.
That's right. Yeah, these sources, they give a pretty thorough look at LPG, what it is, what might, trigger it.
How vets figure it out.
Exactly, how they diagnose it, and the different ways it can be managed in both dogs and cats.
Okay.
And our goal really is to pull out the key stuff so you can get a handle on this condition, but without getting totally lost in the super technical jargon.
Absolutely. We're kind of on a mission to make sense of it.
Yeah.
Why certain breeds might get it more, this whole complex picture.
Yeah.
Okay, so let's just jump right in. In simple terms, what is lymphocytic-plasmacytic gastroenteritis?
Right. So think of LPG as, well, it's the most common type of IBD, inflammatory bowel disease, that we actually see in dogs and cats.
The most common. Wow.
Yeah. And the name itself, it sort of tells you what's happening. It means there's an increase in specific immune cells, lymphocytes and plasma cells, right there in the lining of the stomach and the intestines.
So imagine your pet's gut has its own little security force.
Exactly. And in LPG, these security guards, they get a bit over-enthusiastic, too numerous maybe, and they start causing inflammation right in that inner lining.
It's like the body's defense system gets a bit mixed up and overreacts where it shouldn't.
Precisely. These cells, they're normally there, but here they get overactive. They trigger inflammation in the mucosa, that's the inner layer that absorbs all the nutrients. And sometimes that inflammation can even go a bit deeper into the wall of the intestine itself.
Okay.
And like you said, the fact that it's the most common form, that's key for understanding just how often this pops up.
Right.
Now, maybe we should dig into what's actually, going on inside to cause this.
Yeah, let's unpack that, the underlying process. What's the sort of chain reaction here?
Well, what's really interesting and a bit complicated is that it's thought to be an abnormal immune response right there in the gut.
Abnormal how?
It seems like the animal's immune system starts overreacting to, well, everyday things that are normally present in the gut.
Everyday things? Like what kind of things?
Well, a big focus of research is the gut bacteria, the microbiome.
Right.
Changes in the types or amounts of these bacteria, we call that dysbiosis, that's strongly suspected as a potential trigger.
Dysbiosis, okay.
Yeah, think of the gut like a whole ecosystem of microbes. If that ecosystem gets out of balance...
It can cause trouble.
Exactly. Problems can start.
So it's not necessarily like a bad bug invading from outside, but more like the local residents getting disrupted.
That's a really good way to put it. And it looks like ongoing exposure to certain things, maybe parts of their food, or even these changed bacteria, combined with this kind of over-the-top immune response that ultimately leads to the disease.
But why? Why some pets and not others?
Well, that's the million-dollar question, isn't it? The exact why.
Sure.
Scientists are still working hard to figure that out completely.
Okay, so it's complex. Lots of factors involved. Now, when this inflammation does take hold, which parts of the body are you talking about? Where's the main action?
Primarily, it's the gastrointestinal system, the GI tract.
Makes sense.
We most often see the inflammation hitting the small intestine pretty hard. But the stomach and the large intestine and the colon, they can definitely be involved too.
So it could be one or the other or all of them together.
Exactly. Either on their own or, concurrently. So when we talk digestive upset, these are the main players we're usually looking at.
Got it. And are there ever signs outside the gut? Anything systemic?
Occasionally, yes. Some animals might show other signs, things like maybe a mild drop in their platelet count, little blood cells.
Yeah.
But honestly, these aren't as well understood or seen as consistently. The main hit is definitely on the digestive system.
Right. Focus there. Now, genetics. We know genes play a role in lots of health stuff. Is there a genetic link with LPG? Are some breeds just, more prone?
Absolutely. And this is where it gets really interesting, I think. The sources definitely point out that certain breeds just have a higher chance of developing IBD in general.
Like which ones?
We see it mentioned for Basenjis, Lindehunds, and soft-coated Wheaten Terriers.
Okay, so those breeds have a known IBD link. What about LPG specifically? Any breeds stand out there?
Yeah, for LPG itself, the information suggests a predisposition in German Shepherds and also Chinese Shar-Peis.
Okay.
And there's also a hint that purebred Asian cats might have a slightly higher risk of LPG.
Interesting.
And it's worth remembering, too, some breeds have these specific related conditions, like Irish setters with gluten sensitivity,
Right.
or those protein-losing issues in Wheatons. Sometimes these things can connect or overlap with LPG.
So having one of these breeds doesn't mean they will get LPG,
No, not at all.
but the risk might just be a little bit elevated.
That's a good way to think about it.
Yeah.
It suggests a genetic background that maybe makes them a bit more vulnerable if other factors like environmental or immune things come into play.
Okay, that makes sense. It's not a switch, more like a susceptibility.
Exactly.
Now, who typically gets LPG? Is it older pets, younger pets? Does it matter if they're male or female?
Generally, yeah, it's most often diagnosed in middle-aged and older animals. That's the typical time frame.
But not always.
No, not always. It definitely can show up in younger animals. We've seen cases reported in dogs as young as, 8 months? And cats even younger, maybe 5 months old.
Wow, that young.
Yeah. And as for male versus female, the data doesn't really show any significant difference. No sex predisposition reported.
Okay, so it can potentially appear at various points in adulthood regardless of sex. What about the signs? What are the key things, the red flags that might make someone suspect LPG?
Well, the signs can be a little different between cats and dogs.
How so?
For cats, the most common thing people report is chronic vomiting, like happening again and again over time, not just a one-off thing.
Intermittent but long-term.
Exactly. And that's often followed by chronic diarrhea, usually the small bowel type.
And for dogs, what's typical for them?
With dogs, it's more often the chronic small bowel diarrhea that's the main sign. But if the stomach is the primary place with inflammation, then vomiting might actually be more prominent for them.
Okay.
And for both species, really common signs are things like not wanting to eat, anorexia.
Loss of appetite.
Right. And gradual weight loss over time. That's a big one.
And sometimes more serious signs.
Yeah, in more severe situations, you might see blood, either fresh red blood in the stool or that dark, tarry kind of stool.
Melena,
yeah, which means bleeding higher up. And they might even vomit blood sometimes.
Definitely things that would make you run to the vet.
Absolutely.
So what might the vet find just on a physical exam if they suspect LPG?
It can really vary. It depends a lot on how severe the disease is and which parts of the gut are affected.
Right.
In milder cases, honestly, the physical exam might seem totally normal.
Huh.
But in more advanced cases, you'll likely... Actually.
Okay, so we've got a picture of what it is, what it looks like. Let's circle back to the causes. We mentioned genetics, gut bacteria.
Mm-hmm.
Are there other big factors involved?
Yeah, like we said, it's generally thought to be this mix, right? Genetics, the immune system's reaction, and environmental stuff, with gut bacteria being a huge environmental piece.
Uh-huh.
But the sources also mention a possible role for certain infectious agents, too.
Like actual infections, which ones?
Things like Giardia, Salmonella, Campylobacter, those are mentioned as potentially being linked.
Okay.
But interestingly, even the normal gut bacteria, the ones that are supposed to be there, can cause problems if things get unbalanced.
Right, the dysbiosis again.
Exactly. Studies have actually shown that animals with IBD often have way more bacteria stuck to the lining of their intestines compared to healthy animals.
So sometimes it's more about the regulars causing trouble than a new bug moving in.
Yeah, that's a really important point. It's not always about some external bad guy.
What about diet? Food sensitivity seems so common in pets. Does food play a role here?
Oh, definitely. Dietary factors are seen as potential contributors to that ongoing inflammation.
Like what kind of food components?
The sources specifically call out things like meat proteins, food additives, artificial colors, preservatives, even milk proteins and gluten, from wheat.
So it could be an intolerance or sensitivity to something they're eating regularly that's just constantly poking the bear, so to speak, provoking the immune system.
Precisely. That seems to be the thinking. And again, connecting back to genetics, that predisposition in certain breeds might just make them more likely to react badly to some of these dietary things. It really does seem like this interconnected web.
It really does sound like a complex puzzle.
Correct.
Okay, so if a pet shows these signs, how does a vet actually diagnose LPG? What's that process like?
Well, diagnosing it really involves a systematic approach, basically ruling out other things first.
Differential diagnosis.
Exactly. Ruling out other conditions that could cause similar symptoms. It's a critical step-by-step process.
And what are some of those other conditions they need to rule out?
Oh, the list is pretty long. You've got other types of IBD, like Eosinophilic gastroenteritis, food hypersensitivity is a huge one.
Right.
Metabolic problems, unfortunately, cancer in the GI tract needs to be considered.
Okay.
Then there are various infections, parasites, bacteria, fungi, other gut issues like problems with the lymph vessels, motility disorders, the pancreas not working right.
Exocrine pancreatic insufficiency.
Right, EPI. And specifically for cats, you also have to think about hyperthyroidism, some viral infections like FeLV, FIV, FIP, and pancreatitis too.
Wow, that is a lot to consider. So how do they start narrowing that down? What are the first tests?
Usually, yeah, the first steps are standard blood tests,
Right.
CBC, a chemistry panel, a urinalysis,
Usual workup.
usual workup. But, and this is important, these tests are often normal in pets with LPG.
Oh, really?
Yeah. Sometimes you might see mild anemia, maybe a slight increase in white cells. Low protein levels might show up, maybe more often in dogs with IBD than cats.
So the blood work might not scream LPG,
Mm-hmm.
but it helps rule out other stuff.
Exactly. Helps look for other underlying problems, but doesn't usually pinpoint LPG itself.
Okay. Are there more specific lab tests then that can give more clues?
Yes, there are. Things like measuring vitamin levels cobalamin, which is B12, and folate. That can sometimes point towards inflammation in the small intestine.
Uh-huh.
Tests for pancreatic enzymes like PLI can check for pancreatitis. There's a fecal test, alpha-1 proteinase inhibitor, that looks for protein loss through the gut.
Okay.
And another blood test, TLI, screens for that pancreatic insufficiency we mentioned. And for cats, definitely specific tests to rule out hyperthyroidism, and those viruses are usually recommended.
What about looking inside, like x-rays or ultrasound? Do those help?
Standard x-rays, usually normal, honestly. You might see subtle changes with a barium study sometimes, but it's generally not definitive for LPG. Ultrasound can be useful, though.
How so?
It lets the vet see the layers of the intestinal wall, look for thickening or masses, other abnormalities. But again, it usually won't give that microscopic confirmation you need for LPG.
So imaging helps rule things out, maybe see complications, but not the final answer for LPG itself.
Pretty much, it helps build the picture, eliminate possibilities.
So it sounds like these initial steps narrow it down, but the real proof comes from somewhere else.
You're absolutely right. A really crucial step is often trying a special diet, a hypoallergenic or novel protein diet.
The dietary trial.
Yes, the dietary trial, to see if symptoms improve, which suggests food sensitivity. And of course, checking stool samples for parasites is standard.
Okay.
But the definitive diagnosis, the gold standard for LPG, requires actually getting tissue samples, biopsies from the stomach and intestinal lining,
Right.
and then looking at them under a microscope.
How do they get those samples?
Usually through endoscopy. A small camera goes into the digestive tract, and they can take tiny pinch biopsies.
Uh-huh.
Sometimes, if they suspect issues deeper down where the scope can't reach, or if there are other concerns, surgery might be needed to get those biopsies.
And under the microscope, what confirms it's LPG? What are they looking for?
The key finding is exactly what the name says. An increased number of lymphocytes and plasma cells in that connective tissue layer, the lamina propria.
Okay.
They might also see other changes like the villi, those little finger-like projections for absorption being shorter or blunted.
Right.
And because the inflammation can be kind of patchy, not everywhere,
Yeah.
it's really important to take multiple biopsies from different areas, stomach, different parts of the intestine, to get the full picture.
That makes total sense.
Yeah.
Need to sample enough spots. Okay, so once LPG is confirmed, what's the treatment plan usually look like?
Well, the initial approach is usually outpatient, meaning handled at home, unless the pet is really sick.
Like severely dehydrated or weak?
Exactly. Dehydrated, low protein levels, significant weight loss. Those cases need more intensive supportive care, 5E fluids, maybe electrolyte supplements.
Okay. Any activity restrictions?
Interestingly, no. No specific activity restrictions are usually needed.
Right, so supportive care if needed. What about the longer term stuff? Diet must be huge, right?
Yeah.
Given what we talked about.
Oh, absolutely spot on. Diet therapy is really a cornerstone of managing LPG.
Using those special diets.
Yes. Either an elimination diet using proteins the pet hasn't eaten before, or very limited ingredients, or a hydrolyzed diet where the proteins are broken down really small.
Why do those help?
The idea is to minimize the things in the food that could be triggering that immune response in the gut.
Makes sense.
In really severe cases with lots of protein loss, they might even need temporary feeding directly into the vein, total parenteral nutrition, just until they stabilize.
Wow.
And keeping them on a highly digestible diet long-term is usually recommended. There's also some thought that Adjusting the omega-3 and omega-6 fatty acid balance might help reduce inflammation.
Okay. And vitamins. You mentioned B12 earlier.
Yes. If their cobalamin levels are low, supplementing with B12 is absolutely essential. And for pets with mostly colon inflammation, sometimes adding fiber helps.
So it sounds like diet is tailored.
Very much so. And it's really important for owners to understand LPG is usually managed, not necessarily cured. Flare-ups can happen.
Right, it's a chronic condition. So besides diet, what about medications? What's used to control the inflammation?
Yeah, medications are often needed. Corticosteroids like prednisone or prednisolone, they're usually the first line, the mainstay, for getting that initial inflammation under control.
How do they use those?
Typically start with a higher dose to knock down the inflammation, and then once symptoms improve, gradually taper it down.
Tapering is key.
Very key. Some animals might even need to stay on a low-maintenance dose long-term to prevent relapses.
Okay. Any differences between dogs and cats with steroids?
Yeah, interestingly, cats sometimes need higher doses than dogs, and they might respond better specifically to prednisolone rather than prednisone.
Good to know. Any alternatives to standard steroids?
Budesonide is one. It's a steroid, but it acts more locally in the gut, so potentially fewer systemic side effects. That can be an option if prednisone causes too many issues. And in really severe cases, if they can't take pills, injectables might be used initially.
Okay. Steroids are effective, but they do have side effects, especially long-term. Are there other drugs, immunosuppressants, that can be used, maybe to reduce the steroid dose?
Absolutely. That's a common strategy. Azathioprine is one used in dogs.
Azathioprine, okay.
It can help lower the amount of steroid needed. But, big caution, it's generally not recommended for cats. Higher risk of serious side effects for them.
Right, and it doesn't work instantly.
No, it takes time to kick in, weeks sometimes, so it's not for immediate relief, and requires very careful monitoring with regular blood work because it can affect bone marrow.
So careful monitoring is crucial. What's an alternative for cats then?
Chlorambucil is another immunosuppressant that's often used, especially in cats, as an alternative or add-on.
Okay. Any other common med?
Metronidazole often comes up. It's an antibiotic, also kills some protozoa.
Like Giardia.
Exactly. But it also seems to have some immune-modulating effects in the gut, which can be helpful in IBD, so it's used quite frequently.
Interesting. So multiple effects there. What if a case is really tough, doesn't respond well to these first-line treatments?
Yeah, for those refractory cases, cyclosporine can be a good option.
Cyclosporine.
Yeah. The dose needs to be carefully adjusted for each pet, and often they recommend monitoring the drug levels in the blood.
Okay. Any others?
Sulfasalazine is another one. It's a sulfa drug with anti-inflammatory effects mainly in the colon. So it can be useful for dogs with colitis, large intestine inflammation.
But careful with cats.
Yes. Very cautious use and lower doses in cats due to potential toxicity issues.
It really sounds like a toolbox of medications needing careful selection for each pet.
It is. And tailored to the individual response.
Are there any major precautions or interactions owners should know about with these drugs?
Yes, definitely. We mentioned azathioprine and bone marrow regular blood counts are vital. Metronidazole at high doses can occasionally cause neurological side effects. Cyclosporine can cause things like vomiting or gum overgrowth. There's a theoretical very low risk associated with lymphoma based on human data, but it's considered low in pets.
Right.
Sulfasalazine can rarely cause dry eye, and cyclosporine can interact with quite a few other medications, so it's super important the vet knows everything else the pet is taking.
Absolutely highlights the need for good communication with the vet and that careful monitoring you mentioned.
Crucial.
Speaking of monitoring, how important is follow-up care once treatment starts?
Oh, it's absolutely essential, especially for pets with more severe disease or those on drugs like azathioprine or cyclosporine.
Why so critical?
They need very close monitoring. Regular blood work is common to see how they're responding, check for side effects. Medication doses often need adjusting based on those results and how the pet is actually doing their clinical signs.
So it's an ongoing process.
Definitely. Even for milder cases, regular checkups are important, particularly early on and when tapering medications.
What about prevention? Once a pet has LPG, can anything prevent flare-ups?
Well, if a specific food intolerance or allergy was identified during the diagnosis.
Like with a diet trial.
Exactly. Then strictly avoiding that food ingredient is really the main preventive strategy. Sticking to that prescribed diet is key for long-term management.
Got it. And what are some potential complications, either from the LPG itself or the treatment?
Complications can include Ongoing weight loss or weakness, if it's a tough case to manage. Side effects from long-term steroid use are common.
Yeah.
Bone marrow suppression from drugs like azathioprine. Pancreatitis can sometimes occur. Liver issues, poor appetite, or just general GI upset from the medications themselves.
Okay, so things to watch out for.
Yeah.
Finally, the big question. What's the overall outlook, the prognosis for pets with LPG?
You know, for dogs and cats with mild to moderate inflammation, the prognosis is generally pretty good. Good chance of getting symptoms into remission, maintaining a good quality of life.
That's encouraging.
It is. However, for those with really severe inflammation, affecting large parts of the gut, or those with really bad changes seen on endoscopy, or very low protein or vitamin levels,
Yeah.
the prognosis tends to be more guarded, more challenging. Often, how well they respond to that initial treatment gives you a pretty good clue about the long-term outcome.
Okay, this has been incredibly informative. So just to wrap up, the key takeaway seems to be that LPG is, well, it's complex, but pretty common in pets. It's basically an overactive immune response happening in their gut.
Exactly. And lots of things can contribute. Genes, gut bacteria, diet. It's multifactorial.
Right.
And while it often needs managing long-term, not just a quick fix, the good news is that with a careful diagnosis from the vet and a personalized plan usually involving diet, maybe meds, many pets can live really full, comfortable lives.
That's great to hear. It really underscores working closely with your vet if you have any digestive health concerns about your pet.
Absolutely. Partnership is key.
And it's reassuring there are different options. So on that note, here's something to think about. Given how important gut bacteria seem to be in all this, what future research avenues might hold the most promise? Where could we see breakthroughs in understanding and treating IBD in our pets down the road?
Ooh, that's a really great question to ponder. And definitely an area where there's a lot of exciting work happening right now.
Indeed.
Yeah.
Well, thank you for taking this deep dive with us today into such an important topic. We really hope this has given you, our listener, a much clearer picture of Lymphocytic-Plasmacytic Gastroenteritis.
Hope so too.
Until our next deep dive, keep exploring the fascinating world of pet health.